Development of neural tube. Neurulation, process of formation of neural tube, occurs in the third week of life after gastrulation. Formation of three germ layers gives origin to brain and spinal cord. Formation of neural tube. Ectoderm, mesoderm, endoderm. Notochord gives signals to ectoderm. Ectoderm thickening to form neural plate. Neural plate invaginates due to signals from notochord. Neural groove formation. Neural crest cells at the junction surface of ectoderm and neuroectoderm. Surface ectoderm not involved in neural plate formation. Ends of neural groove fuse to form neural tube. Neural tube is formed earliest at the cervical region. Sclerotome surrounds the neural tube and notochord, gives origin to axial skeleton. Neural crest cells and mesoderm migrate to different parts of the body. Derivatives of neural crest cells. Sclerotome, paraxial mesoderm form somites. Sclerotome, myotome, dermatome. Neural tube, neural crest cells, fourth germ layer. Fourth germ layer is coming from here. So the ectoderm starts thickening, causes the neural plate which invaginates and forms the neural tube. This at the junction of ectoderm and neuroectoderm is neural crest cells which migrates to different part of the body and gives derivatives of the neural crest cells. Neuropores communicates neural tube with amniotic cavity. Cranial neuropore failure to close, anencephaly. Caudal neuropore closes by 28th day. Failure to close, spina bifida. In between neural tube defects due to deficiency, these are known as neural tube defects due to deficiency of folic acid, prevented by giving folic acid to pregnant women in first trimester. Dura mater, spinal cord, spinal fluid, vertebra. Dura mater, spinal cord, spinal fluid, and vertebra. Cranioarchesis, severe form of neural tube defect. Entire neural tube is open, that is cranioarchesis. Neural tube derivatives. Cranial part forms brain. Caudal part forms spinal cord. Three primary brain vesicles. Prosencephalon, forebrain. Mesencephalon, midbrain. Rhombencephalon, hindbrain. Prosencephalon again, telencephalon and diencephalon. Mesencephalon gives mesencephalon. Rhombencephalon gives metencephalon and myelencephalon. Lateral view of neural tube. Prosencephalon, mesencephalon, rhombencephalon. Forebrain, midbrain, hindbrain. 3 to 4 weeks embryo. 5 secondary brain vesicles. So from the prosencephalon, you have again the telencephalon here, which will form the cerebrum. You have the eye cup from the diencephalon. Diencephalon also give rise to thalamus, hypothalamus, and epithalamus. Then in the mesencephalon will give rise to midbrain, and the rhombencephalon, you have metencephalon, will give rise to pons and cerebellum, and myencephalon will give rise to medulla oblongata. here. They have given a table. So primary brain vesicle, prosen, meson, and rhomben. Prosen gives talon and dian, secondary brain vesicle. Derivative, talon, cerebrum, corpus striatum, dian, thalamus, hypothalamus, metathalamus, subthalamus, epithalamus, pars nervosa, posterior lobe of pituitary. Optic stalk forms retina and optic nerve. Cavity, telencephalon, lateral ventricle, big ventricles, and diencephalon, third ventricle. Mesencephalon, midbrain, aqueduct of Sylvius. Rhomencephalon, metencephalon, and myelencephalon. Metencephalon, pons and cerebellum. Myencephalon is medulla, fourth ventricle. Functional columns of cranial nerve nuclei. Functional columns are afferent, which is sensory, and efferent, which is motor. Allows single cranial nerve to perform many functions via the nuclei. Efferent functional columns, which is motor. General somatic efferent supplies muscles of head and neck with somatic origin. Myotome of cervical somites makes diaphragm, which is innervated by phrenic nerve. Diaphragm comes from cervical somites. Nucleus of GS, general somatic efferent, is hypoglossal nucleus. Myotome of occipital somites, tongue muscles. And oculomotor trochlear abducent nucleus, myotome of preoccipital somites, extraocular muscles. Special visceral efferent gives motor supply to pharyngeal arches. Special visceral efferent gives motor supply to pharyngeal arches. Arch 1, 2, 3, 4, and 6. First is mandibular nerve, motor nucleus of trigeminal nerve. Second is facial nerve, motor nucleus of facial nerve. Third is glossopharyngeal. Fourth is supralaryngeal nerve. And sixth is recurrent laryngeal nerve. Superior laryngeal nerve and recurrent laryngeal nerve are branches of vagus. All glossopharyngeal, superior laryngeal, recurrent laryngeal are having nucleus ambiguous, which gives origin to cranial nerve 9, 10, also sometimes cranial nerve 9, 10, and 11. General visceral efferent. Parasympathetic column carries secretomotor fibers. Nucleus of general visceral efferent. Inferior salivatory nucleus, cranial nerve 9, preganglionic parasympathetic fibers, otic ganglion, parotid gland. Superior salivatory nucleus, cranial nerve 7, submandibular ganglion, submandibular and sublingual gland. Lacrimatory nucleus, caudal part of SSN. Cranial nerve 7, sphenopalatine ganglion, lacrimal gland, nasal gland, palatal gland. Edinger-Westphal nucleus, cranial nerve 3, ciliary ganglion, ciliaris, and sphincter pupillae. Dorsal nucleus of vagus, cranial nerve 10, supplies ganglions in heart, lungs, foregut, midgut. So organs are heart, lungs, foregut, midgut. Cranial nerve with parasympathetic function is cranial nerve 3, 7, 9, and 10. Afferent functional columns. Special visceral afferent taste sensation from tongue. General visceral afferent general sensations from tongue, tonsil, palate, pharynx, carotid sinus, carotid body, and larynx. Common nucleus, nucleus tractus solitarius. General somatic afferent nuclei involved mesencephalic nucleus of trigeminal midbrain, chief sensory nucleus of trigeminal pons, special nucleus of trigeminal medulla C1 and C2 segments of spinal cord. Nuclei involved general somatic afferent mesencephalic nucleus of trigeminal midbrain, chief sensory nucleus of trigeminal pons, spinal nucleus of trigeminal medulla C1 and C2 segments of spinal cord. Nerves involved in general somatic afferent: cranial nerve 5, trigeminal nerve from face and body; cranial nerve 7, facial nerve from auricle; cranial nerve 9, glossopharyngeal nerve from middle ear, Eustachian tube, and mastoid from body only; cranial nerve 10, auricular branch of vagus nerve. Special somatic afferents, somatic origin, carry special sensation. Nucleus involved vestibular nucleus, cochlear nucleus. Neuron, structural and functional unit of CNS. Nucleus versus ganglion. Nucleus or gray matter in CNS, ganglion is in parasympathetic nervous system. It is aggregation of cell bodies. Source, nucleus is from neuroectoderm and ganglion is from neural crest cells. Tracts versus nerves. Collection of axons in central nervous system is tracts. In peripheral nervous system is nerves. Tracts are also known as white matter, fasciculus, lemniscus. Nerves are for example ulnar nerve, median nerve, facial nerve. Glial cells, supporting cells, function and source. Astrocyte, oligodendrocyte, ependydymal cell, Schwann cell, microglial cell. Astrocyte, blood-brain barrier. Oligodendrocyte, myelin sheath formation in central nervous system. Ependymal cells, lining of ventricles. Schwann cells, myelin sheath formation in peripheral nervous system. Microglial cells, phagocytic cells. So astrocyte, oligodendrocyte, ependydymal cells are coming from neuroectoderm. Schwann cells, which forms myelin sheath in the peripheral nervous system, is coming from neural crest cells. And microglial cells are phagocytic cells which are coming from mesoderm. So this is a neuron, Schwann cells coming from neural crest. Microglial cells, ependydymal cells, oligodendrocytes, astrocytes. CSF and ventricles. Secretion of CSF. It is secreted by choroid plexus. Major contribution. Choroid plexus is derived from anterior and posterior choroidal arteries, which supplies lateral and third ventricle, and also from pica, that is more common than ica, which supplies fourth ventricle. Pica is posterior inferior cerebellar artery. Ica is anterior inferior cerebellar artery. Here they have shown choroid plexus. Minor contribution: ependymal cells lining ventricles, brain substance, through perivascular space. Note: CSF is not an ultrafiltrate from blood. Circulation and drainage of CSF. Circulatory pathway: lateral ventricle, foramen of Monro, third ventricle, cerebral aqueduct of Sylvius, fourth ventricle, minor, central canal of spinal cord, majorly to subarachnoid space, foramen of Magendie, median aperture 1 in number, foramen of Lashka, lateral aperture 2 in number, foramen of Magendie goes to cisterna magna, cerebellomedullary cistern, foramen of Lashka goes to cerebellopontine cistern, arachnoid villi granulations, dural venous sinus, mainly superior sagittal sinus. Arachnoid villi granulations, dural venous sinus, mainly superior sagittal sinus. Note: foramina of Lashka and Magendie are present in inferior medullary velum. Inferior and superior medullary velum from roof of fourth ventricle. Applied anatomy. Epidural and subdural hemorrhage. Epidural hemorrhage and subdural hemorrhage. Site: epidural is above dura, subdural is below dura. Epidural is arterial, subdural is venous. Epidural cause is rupture of middle meningeal artery. Subdural is rupture of bridging veins. Appearance on CT scan in epidural is biconvex lens shaped. On CT, subdural is crescent shaped. Lucid interval is seen in epidural most commonly and sometimes also seen in subdural. Here are types of brain hemorrhage: subarachnoid hemorrhage, epidural hemorrhage, hematoma, intracerebral hemorrhage, subdural hemorrhage. Note: lucid interval is brief period of regaining consciousness after a head injury. Pterion, meeting of four bones: frontal bone, parietal bone, squamous temporal bone, greater wing of sphenoid. So frontal bone, parietal bone, greater wing of sphenoid and squamous temporal bone, they meet at pterion. Significance: anterior division of middle meningeal artery lies beneath pterion. Fracture of pterion, epidural hemorrhage. Anterior division of middle meningeal artery. Aqueductal stenosis, block in cerebral aqueduct of Sylvius. Third ventricle is dilated. Most common cause of congenital hydrocephalus. Congenital aqueductal stenosis. Aqueductal stenosis. Congenital hydrocephalus, most common cause. Third ventricle dilated. Dandy-Walker syndrome. Atresia of foramen of Laska and Magendie. Fourth ventricle is dilated. Dandy-Walker syndrome. Cisterns. Enlarged subarachnoid spaces. Pia mater dips into a sulcus. Subarachnoid space is enlarged. Cistern. What are cisterns? Cisterns are enlarged subarachnoid spaces. Pyometer dips into a sulcus. Subarachnoid space is enlarged. Cistern. These are the subarachnoid cisterns. Pontine, peduncular, cisterna magna. Midbrain arachnoid pia, cerebral peduncle, interpeduncular cistern. Cistern location and content. Interpeduncular cistern between the cerebral peduncles contain posterior part of circle of Willis, posterior cerebral artery, posterior communicating artery. Pontine cistern, ventral surface of pons, basilar artery. Cerebellomedullary cistern, cisterna magna, between cerebellum and medulla, vertebral artery, posterior inferior cerebellar artery, cranial nerve 9, 10, 11, 12. Quadrigemina cistern, behind the corpora quadrigemina. Two superior and two inferior colliculi, between splenium of corpus callosum and cerebellum. Great cerebral vein of Galen. Sylvian cistern, over the lateral sulcus. Sylvian cistern, over the lateral sulcus. Middle cerebral artery, superior middle cerebral vein. Lateral ventricle, cavity in the telencephalon. Forms cerebrum and basal nuclei. Parts. Here they have seen the horns of lateral ventricle. Temporal horn, occipital horn, corpus callosum, below that is fornix. Parts and their location. So this is the anterior horn in frontal lobe, central part in frontal and parietal lobe, atrium, posterior horn, and inferior horn in the temporal lobe, interventricular foramen, third ventricle, cerebral aqueduct, occipital lobe, fourth ventricle, median aperture, central canal. Relations. Caudate nucleus is in close relation to lateral ventricle. Forms floor and central part of anterior horn and roof of inferior horn. So this is the caudate nucleus. It forms the floor and central part of anterior horn and roof of inferior horn. Relations of lateral ventricle. This is the corpus callosum. This is rostrum of the corpus callosum. Septal area, anterior perforated substance, amygdaloid body, anterior hypothalamic nuclei, posterior horn of lateral ventricle, inferior horn of lateral tail of the caudate nucleus, thalamus, stria terminalis, body of the caudate nucleus, head of the caudate nucleus, thalamus, stria terminalis. Relations of anterior horn. Medial wall of anterior horn is septum pellucidum, the medial wall. Lateral wall is caudate nucleus, and roof is body of corpus callosum. This is corpus callosum. This medial is caudate nucleus, and lateral is caudate nucleus, sorry, and medial is septum pellucidum in the anterior horn. Central part extends from interventricular foramen of Monro to splenium of corpus callosum. Roof body of corpus callosum. Floor you have caudate nucleus, fornix, thalamus, and thalamostriate veins. Posterior horn. Anterior and posterior going from that corpus callosum, genu, body, splenium, forceps minor, frontal lobe, tapetum, posterior horn of lateral ventricle, forceps major, occipital lobe. Relations of posterior part. Roof and lateral wall is tapetum. Medial wall has two elevation, bulb of posterior horn due to forceps major and calcar avis due to calcarine sulcus. So this is the bulb of the posterior horn. Fibers of forceps major, tapetum, optic radiation, cavity, calcar avis, calcarine sulcus. Two elevations are calcarine avis due to calcarine sulcus and bulb of posterior horn due to forceps major, which is coming from splenium of corpus callosum and going to occipital lobe. Inferior horn. Inferior horn, stria terminalis, tail of caudate nucleus, hippocampus, roof, floor, hippocampus, Relations of third ventricle. Anterior wall, anterior commission, lamina terminalis. Roof, choroid plexus. Lateral wall, thalamus and hypothalamus. Posterior wall, pineal gland. Posterior commission, aqueduct of Sylvius. Floor, tuber cinerarium, optic chiasma, infundibulum, mammillary bodies, posterior perforating substance, tegmentum of midbrain. Infundibulum, mammillary bodies, posterior perforating substance, oculomotor nerve is equal to oculomotor nerve, tuber cinerarium, interpeduncular fossa. Lamina terminalis, remnant of cranial neuropore. Circumventricular organ, no blood-brain barrier. Perinode syndrome, pineal gland, tumor comprises dorsal part of medial midbrain. So here is the pineal gland. Its tumor suppresses dorsal part of midbrain is perinode syndrome. Lamina of pineal gland, superior lamina and inferior lamina. Superior lamina is habenular commission and inferior lamina is posterior commission. Fourth ventricle, cavity of metencephalon, forms pons and cerebellum. And diencephalon, forms medulla. Relations: roof, cerebellum, superior medullary velum, nervous tissue, inferior medullary velum. Relations of fourth ventricle. Floor, posterior surface of pons and upper medulla. This is the diagram of fourth ventricle. This is the median sulcus, sulcus limitans, facial colliculi, stria medullaris, hypoglossal triangle, vagal triangle, inferior fovea, area postrema, vestibular triangle, vestibular nuclei, superior fovea. This is pons and this is medulla. Superior fovea contains bluish gray pigmentine structure, which is here superior fovea, locus ceruleus, which secretes dopamine. Area postrema, chemoreceptor trigger zone, center for vomiting, no blood-brain barrier, some circumventricular organ. This is the median sulcus, median eminence, sulcus limitans, facial colliculi, vestibular area, hypoglossal triangle, vagal triangle. Facial colliculus, due to swelling of axons of facial nerve, contain abducent nucleus. Injury, damage to axons of facial nerve, more common than abducent nucleus. Facial muscles, more than lateral rectus affected. Facial colliculi, due to swellings of axons of facial nerve. Spinal cord, location and extent.